Hello there, I'm going to call myself Imogen for this video, but it's not my real name and I've changed the names of my children too. I started drinking to manage an abusive relationship and I was too scared and embarrassed to ask my family for help. And I was able to manage this for a while and manage normal daily life. My children went to school and I went to work as usual. After a serious assault by my now ex-boyfriend, the police and social services removed him from the family home. And my children were reacting at school and they had behavioural problems, which is a sign that they had seen the abuse between the two, between my ex-partner and I, and my children were also aware of me drinking. At times they had to put me to bed and had to wake me up in the morning to take them to school. Before I knew it, I was drinking in the morning to escape my experiences and my memories. I was getting arrested for being drunk and committing crime related to my drinking, and I lied to my GP about it all, and he thought I was having a nervous breakdown. When my family babysat for me, I used to get drunk whilst I was out, and my parents still didn't realise what I was doing or what effect this was having on their grandchildren. It began to be normal for the children not to go to school but to stay at home and look after me. After one court appearance, it looked like I was likely to go to prison. My mum had already taken my children to live with her for their own safety. She had realised how much I was drinking and how vulnerable they were. I was extremely vulnerable myself through drinking so much and was once found by a stranger after blacking out. Social services, the police and probation couldn't understand why I was drinking so much, and at the time I was drinking up to 3 bottles of wine and a bottle of spirits a day sometimes, and I was also getting arrested a lot. The judge sent me on an 8-week course to look at my drinking and also sent me to a psychiatrist. My 2-year suspended sentence was dependent on me getting into treatment. My key worker advised me not to stop drinking, as I could have died if I didn't have medical supervision, as I was drinking so much I was actually physically dependent on it. A risk assessment was done on me and my children by social services, and the children's names were put on the child protection register. Some people say that they hate social services, but they really did save my life and my family. I began to understand the reasons behind my drinking and learned how I could take back control over my life. By this time I had started with Oasis, which is Brighton and Hove's women-only service. I cut down my alcohol intake with the help of the alcohol counselling service, and before too much longer had cut it out from my life altogether. I started the Oasis programme, which is called POCAR, which stands for Parents of Children at Risk, and was tested for alcohol daily. I had group work, one-to-one counselling, and also had Triple P, which stands for the Positive Parenting Programme, which is run by the Children and Young People Services at the council. I saw my children 2 days a week with a supervisor. They were upset and their behaviour had changed a lot. My son Peter was 8 and he ended up seeing a psychiatrist from the Child and Adolescent Mental Health Service, or CAMS, and had a mentor at school. My daughter Ellie was about 2 when she went to live with my mum, and it was a really difficult time for them both. I had brilliant support from Oasis, my peers in the groups, and I found out I was not alone. Within a year the children were back at home living with me, with a follow-up of 6 months by social services and Oasis aftercare. Looking back at it, I put my children through serious emotional abuse and heartache. I had faced prison, assault and death through my drinking. My children are now happy. They're doing really well at school, and I'm able to talk about the effects this time had on my son, as he still remembers quite a lot of it clearly. I'm now at college studying and I'm working on placement. I feel my experiences have informed the way I'm able to work with others. I know that there is life after recovery, although it can be hard, and I'd like to thank social services and the drug treatment system in Brighton and Hove, as without them I would have lost everything. Thank you.